Welcome to High Tea with Grace, where we spill the tea on HIT. Today, I'm at the ViVE conference in sunny Los Angeles, and I'm honored to welcome to the pod Dr. Sari Green, Physician Executive Director for Accuity Healthcare. Thanks for joining me.
Hi, Grace. Thanks. I'm glad to be here.
So thrilled to learn from you today. So tell me about the career path that brought you to your role today.
My goodness, it's been a windy road. I actually started out as a dance major in undergrad. That took me through medical school, ultimately to becoming a surgeon. And then I transitioned into this space where I'm working really more on the kind of administrative side of medicine, really focused on the middle revenue cycle. I am currently Physician Executive Director at a company called Accuity.
Love it. I love it. So you talk a lot about clinically governed AI. What does that mean in practice? And how is it different from simply layering AI into random rev cycle workflows?
Yeah, so I think clinically governed AI, when I think about it, I think about not so much just adding AI in for speed, right? We're seeing it really make an influx into the middle revenue cycle, into healthcare in general, and into the middle revenue cycle now. Going from not so much just kind of a pilot project, right? Experimental, but it's really operational now. And there's some risks that come with that, especially in, a high-risk industry like healthcare, right? And so clinically governed AI means having that clinical voice throughout the process from the point of design so that it is built with physicians, built on adjudicated cases through, implementation and application so that it is really used to support judgment as opposed to replace it. And then just really as an ongoing feedback loop. So the users are physicians, are clinicians whose feedback is continually being used to kind of update it and make it better. So really, really clinical governance means, physician voices, physician involvement, not so much as a token, but really embedded into the process from design all the way through outcome.
So fascinating, because we all know there's typically a separation of church and state between the front office and the back office, right? And what's being done. And you as a clinician, now also working as a technologist in the back office, and that clinically governed AI really making an impact. It's a really unique new trend. So, how do you ensure that physician oversight meaningfully shapes these AI models, and rather than just being symbolic checkpoints after deployment?
Again, I think just having physicians and clinicians integrated throughout the entirety of the process. So model design, training of the technology, application of the technology, continuous refinement of the technology. It really needs to be kind of physicians at the forefront because we're talking about medicine, right? This is all about medicine. And so that needs to be really embedded in, at every step along the way.
Yeah. And what risks do health systems face when AI and rev cycle is not clinically grounded, especially around documentation integrity, medical necessity, and important issues like that?
Yeah. So what we know with AI in general, right? It can really amplify distortion. It can amplify gaps. It can amplify ambiguity. And nowhere do we see that more as a potential risk than in healthcare, right? And so we need to use AI where it really works, right? So to take huge amounts of data, surface patterns, identify potential gaps in documentation, but ultimately we need physicians to be, I like to say, the arbiters of truth, right? We need the physician judgment, the physician interpretation to have the final say. So it's really using to augment their judgment, augment their work, make it more efficient for them, but not replace them.
You mentioned to me that Accuity Healthcare employs hundreds of clinicians in some form or fashion. And can you tell me a little bit about that? How many did you say?
Yeah, we have well over 200 full-time US-based physicians. So we have all come from clinical practice. We have gone through extensive proprietary training to understand this piece of the healthcare world, right? Clinical doctors are not trained and don't really know this piece of the revenue cycle, nor should they, right? We want them taking care of our patients. And so we have a very large team of physicians who can help to bridge that gap so that our clinical colleagues can really spend their time and their energy where we need them most, which is on the front lines, caring for patients. And so we can bridge that gap because we know that clinical world, and now we know this revenue cycle world, the coding space, the CDI space, the importance of translating that clinical reality, right? What happened during the patient stay into documentation, into that final coded record, and ultimately out the door as a clinically accurate, clinically sound claim. And so we can do that without putting that burden onto the doctors who are taking care of the patients.
As it should. As it should. Where do you see the greatest opportunity for AI now to improve revenue integrity?
I think we need to really look at that upstream. So in the middle revenue cycle, before that claim goes out the door, right? The more we can anchor the clinical reality in a defensible, supported way, clinically supported way, take away the ambiguity, the more we can anchor that in before that case goes out the door, the less susceptible we are to the payer reinterpretation that happens and the denials. And when those denials do come, they are more defensible. They require less rework. So I think in that kind of post-discharge pre-bill space where all of it comes together, that's where the real opportunity is.
How should CFOs and revenue cycle leaders think about ROI when investing in clinically governed AI versus traditional automation tools?
I think CFOs obviously are thinking about the revenue lift, but I think we need to look broader than that. It's not just the revenue lift. It is going to be predictability, sustainability, right? Sustainability of case mix index, sustainability of quality metrics that we are impacting. Those quality metrics translate into reputational value. There's an ROI associated with that. And then decreased administrative drag, right? Decreased rework required. So kind of increased efficiency. So those may be less quantifiable just right on the surface, but all of those factor into a return on investment.
Fascinating. What metrics truly indicate revenue integrity improvement? How can you tell that it's actually getting better, not just faster processing, but really stronger compliance and sustainable reimbursement?
I think looking at the final DRG assignment related denial statistics, right? Where are we ending up with that? That's going to tell us in terms of clinical integrity, revenue integrity, is that clinically sound case really translating into fewer DRG denials, decreased FTE hours per downgraded case, and again, the stability in the CMI, the stability kind of throughout the system versus kind of the unpredictable spikes.
Denials continue to rise nationally. Despite all of this technology everywhere, it's like, why is that the case? And from your perspective, are we dealing with documentation gaps, payer behavior shifts, or both? How can AI really fill that blank and address this proactively?
Yeah, I think we're dealing with both. I think we're seeing kind of really an increase in denials in terms of kind of automated denials, and the scrutiny on documentation is becoming more exacting. And so we're seeing an increase on that side, but there's another piece to it that is less visible, but very much there. And that's kind of the invisible losses that come with the translation of the clinical care into the documentation, into the coding, and then that administrative record kind of going out as a claim. And as it goes through those steps, there are different experts at each point along that process. And really critical information gets lost in that translation, right? These are different languages. Like any two languages, medicine and coding don't translate all that well, and we lose important information. And the default there is, it defaults to conservative reimbursement. The denials part is visible. There's also this kind of hidden loss that just comes from the complexity of the process. And we're really looking at Accuity to tackle that and get that translation as accurate and precise as possible pre-claim going out.
Wow. Now, my listeners love to hear about what's going on in the industry, and thank you so much for sharing your wisdom with us. They also love to learn from amazing women leaders like yourself about what it takes to keep going, to be the amazing leader that you are. If you could give your younger self a piece of advice, what would you tell her?
I would say not to underestimate the power of bridging worlds. And I think just personally and professionally for me, I've seen that, and I'm really seeing it in the healthcare space, from my personal, as it translated into a professional life, right? Going from a dance major into medicine, into surgery, into really a revenue cycle, right? Seem all really disparate. But for me, I can see the common threads all the way through. And we see that with, I think, how healthcare is evolving as well. I was just at a CMO conference a couple of weeks ago, and there was so much conversation about bridging the gap between the clinical world and the financial world. And, we're seeing that with the technology too, between the technology worlds and the clinical worlds. And so having people who can speak both languages and kind of help find the place in between really propels us forward.
Very interested. As a leader, you face trials and obstacles in your life. What are some advice that you give people, or you would give yourself to just keep going despite obstacles coming your way?
What I always do is what I try to do is, rather than looking at things as obstacles, right? That's part of life. But if you can shift your mindset to, how is this working for me? It really opens up a different lens of seeing, because there's opportunity in every obstacle, right? There's that book called The Obstacle is the Way. And so I think when we shift that way, we can really kind of harness the power of change and use it towards, rather than keeping us stuck, towards really moving us forward to opportunities we might not have otherwise even recognized.
Oof. Harness the power of change, ladies. Take that with you. To finish this conversation off right, where can our listeners find you online? Are you on LinkedIn?
Yes, I'm on LinkedIn, and you can learn more about Accuity at accuityhealthcare.com.
Too good. Thanks so much for joining us today.
Yeah, thank you, Grace.
And thanks to you folks for joining us too. Check out the High Tea with Grace podcast website for more interviews with great guests like Dr. Green today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.